Dr.Matt presents the Covid-19 vaccine.
Hey, Hanagwai! I hope you're all swell, but not swollen. A huge hawa to all the amazing nurses, the public health team, and the wonderful people at Haida Health for all the hard work they've done so far throughout the pandemic. And a big hawa to you for everything you do to keep everyone else safe. With the help of my great team, we've followed the news, followed the science, we've looked at the studies. The great news?
This vaccine is safe.
The vaccine's really, really safe.
Whoa.
And anything that you see on the internet that says otherwise is probably fake news. What is a vaccine? I don't know.
What?
Just kidding, I know. Essentially, a vaccine is a way of stimulating our own immune systems to protect us from catching or spreading a dangerous disease. Nothing can kill illness better than our own bodies. Typically, we start with the actual virus you want to fight. But we got to do something to make it safe before we introduce it to the immune system. Otherwise, we'd just be giving the person the disease. That's not good. So this is kind of how it usually works.
We usually start with a live virus.
I'm a deadly virus coming for you.
We'll take away its weapons, or we'll slow it down and cripple it.
I'm coming for you, you whippersnapper.
Sometimes just little parts of it, and use that to make the vaccine.
And that's usually how it goes. One of the coolest things about vaccines is they're designed to work in two big ways. Firstly, they help protect the person who got the vaccine, prevent them from getting sick, dying, or having permanent complications from the virus. Secondly, they can work on a big level and even help protect people who didn't get the vaccine. Whoa! This requires something called herd immunity. That's something you've heard of? Dad joke.
Herd immunity.
This friendly young heifer named Paul gets COVID, right? The poor guy doesn't even know he's got it, so he's just hanging out doing his thing, doing everything he normally does. And he wanders to the neighbor Jessica, who gets COVID. And she's been hanging out with Heather, but lately Heather's been all like, eh. So Jessica goes to hang out with Todd, who of course lives with Mark, and then they both get COVID. Heather's still like, eh. So she goes to hang out with Amber, Crystal, and Tiffany, and you know, we've all got COVID. COVID, it's everywhere. Oh, the humanity. But let's say that bright bovine Sally goes ahead and gets herself vaccinated, and she takes her friend Leo with her too. And wouldn't you know that Troy decides to get himself an old vaccination, followed by Jasmine, and old Stumpy up there gets one too. Poor old heifer Paul still gets COVID, not feeling too bad though, so he goes to hang out with Sally, Leo, and Troy, but COVID ain't going nowhere. Because Heather was still like, Jessica didn't get vaccinated and she gets COVID. Well, in the meantime though, Lamar, Joni, and Betsy get vaccinated, followed by T-Bone, and the lucky buck Paul decides to go for a roll in the hay with Sydney Al. They both got COVID. Good old Otis jumps on the bandwagon. COVID's trying to find somewhere to go, right? But can't find anyone to infect. Even though Stacey, Rob, and Omar didn't get vaccinated, they're safe because of herd immunity. So getting a vaccine will protect you and the smelly cow next to you.
So this is why there's such a big push to try to vaccinate as many people as possible. In order for herd immunity to take effect, you need to vaccinate at least 70 to 80% of the population.
What?
So getting vaccinated will help protect you. It'll also help protect people who haven't or couldn't be vaccinated, because they're also part of the herd. So the Moderna vaccine is an RNA vaccine, and these work a little bit differently than the ones I described earlier in the video. So let's talk about how the Moderna vaccine actually works.
Yeah.
This is the real coronavirus. But for our purposes today, this is the coronavirus. This delicious but nasty little cupcake. So rather than using parts of a real virus, Moderna uses something called messenger RNA. mRNA is essentially the recipe on how to make this tiny little protein. And it's this sneaky little protein that allows the COVID virus to stick to our cells and then infect them. So with the Moderna vaccine, they're not giving you this. They're not even giving you this. It's actually just giving you this, which is the genetic recipe on how to make that little protein. So when you get the vaccine, it's your own body that makes this. This does not change your DNA. Imagine that. This cookbook is your DNA. This is my cherished family cookbook that's been handed down for generations. And all I ever eat is this. I don't eat anything else. Actually, I don't like anything else. Anything other than this makes me angry and sick. So this is essentially how our immune system learns to recognize what is you and what is not you, so that it can attack and destroy anything that is not you, like the COVID virus. So when you get the vaccine, your body's automatic reaction is to try out this little recipe. Try it out, taste it out, see how it goes. It hates it. It recognizes right away that it's not from this cookbook. It's not you. The messenger RNA at no point goes into the cell's nucleus where the DNA is stored. The vaccine is not trying to glue pages into my secret family recipe book. In fact, after your cell uses it to make some of the proteins, the mRNA is destroyed. Now my immune system can learn to recognize this protein and attack anything it sees in the future with this protein on it. Think of this as a great workout for your immune system. And what happens when you work out? You get hot, you get sweaty, you get tired, you get sore. Those are the exact same symptoms that most people have when they get a vaccine, and those are totally normal. It actually means that your immune system's doing its job and it's getting pumped. Let's go down and visually flesh out this analogy. So imagine that my house is our cell, all right? So I'm just part of the cell. Fixing some things over here, doing a little bit of this over there, doing whatever needs to be done. That's what I am now. So I'm staying busy in my cell when all of a sudden I hear,
Hello, sir. I am the COVID-19 vaccine, and I have a special delivery for you.
The mRNA is coated in a thin layer of oil similar to your cells, so as soon as they touch, the cell just pulls the vaccine right in. Now your cell is ready to start trying to bake that recipe. Voila!
I'm done making our protein. Our bodies don't need the instructions anymore. The cells break it down and get rid of it, and it doesn't stay in your system.
The cell then puts those proteins on the outside of its surface, and the immune system comes by for a taste. And lo and behold, the immune system does not like it. It gets pretty upset, actually.
Well, it's official. This little disgusting thing is not in here. Not in there. And everyone knows I don't eat anything that's not here. This is not me, and I do not like it. I am the immune system. You just with the wrong person.
My new mission in life is to destroy this, or anything that looks remotely like this. So I better hit the gym.
Gratuitous montage!
Like a professional boxer, your immune system prepares to fight a new challenger.
Jax, making antibodies.
I've got my shots and I'm wearing my mask.
Your immune system has never faced this opponent before, so it will take time to get ready, and lots of work.
I wash my hands and I'm keeping my distance. I'm getting beefed up on a hand resistance.
You're so sweaty.
I trust you, Dr. Bonnie Henry. Who's me? But I got the vaccine. I'm the baddest mother that you've ever seen. I'm the baddest mother. I'm a bad mother.
Your body knows exactly what to do. With a little bit of time, it becomes stronger.
Protect my elders and saving the world. I'm doing my part to save us all, girl. You know I love you, baby. You know I do. I'm not living it. I'm protecting the people. It's just a shot. I ain't scared of no needle. Even little babies get needles.
Eventually, the young Padawan metamorphosizes into a Jedi Master.
Nothing's gonna stop us now.
Ready to fight the real COVID virus.
Hey, kitty, that's a real nice mask you got. Nothing's gonna stop us now. Nothing's gonna stop us now. I'm killing COVID.
Hey, you're staying a little close. You mind backing up?
Nothing's gonna stop us now. Nothing's gonna stop us now. I'm killing COVID. Remember, you always gotta wash your hands. Nothing's gonna stop us now. Nothing's gonna stop us now. I'm killing COVID.
2 meters of personal space.
Nothing's gonna stop us now. Nothing's gonna stop us now. I'm killing COVID. It's really hard to kiss with these masks on. Nothing's gonna stop us now. Nothing's gonna stop us now. I'm killing COVID. Hooray! I just got my vaccine.
And now the student has become the master.
I'm killing COVID now.
So now you've had one dose of the vaccine, you're feeling like a superstar. You've got about 80 to 90% protection from COVID. When you get the second dose, It's another chance for your body to bake that recipe and get super jacked. Take it to a whole new level.
Kalima!
Kalima. After the second dose, you're a level 5 COVID wizard, and you're virtually protected from dying from COVID or being hospitalized from COVID. Thanks for watching, everyone. I hope the video helped to give some guidance when you're making the choice of whether or not the vaccine is something that's right for you. We're all in charge of our own bodies and entitled to make decisions about our own healthcare, and fully within our rights to decide what we do or do not put into our own bodies. That being said, I really encourage everyone to get the vaccine if you can. It'll be good for you, and it'll be good for the herd. Maybe think about it this way: COVID is not going anywhere anytime soon. It's going to keep circulating, and we're going to reach herd immunity either because we're getting infected or because we get vaccinated. So you have a choice. Everything has risks, even vaccines. But I promise you, the risks associated with actually getting a COVID infection are way higher than the risks of taking the vaccine. And we're just starting to learn about some of the long-term consequences of getting infected with COVID. Permanent changes to your lungs and your heart and your blood vessels, even in young people. So when a dose does become available to you, give it some serious consideration. If you have any questions or concerns, talk to one of your healthcare providers or someone that you trust. If you don't believe me, maybe you'll believe one of these amazing folks.
Hi, Haida Gwaii. Please get vaccinated for all of us.
Yes, get vaccinated.
I got my vaccine, and I think you should too.
Please, Haida Gwaii, get the shot.
Alright, I just got my vaccine, and I would recommend it to anyone and everyone. Come with me if you want to live.
So let's talk safety. The likelihood of having some sort of serious reaction from a vaccine is very low. You're way more likely to actually get hurt, injured, or killed doing things that you do in everyday life, like driving to the store, riding your bicycle, or even just eating food. Worldwide, over 300 million doses of these vaccines have been given out, and there have been no deaths as a result. That's pretty incredible. As of the 13th of March, according to the Government of Canada website, almost 3 million people have been vaccinated in Canada. The risk of having a reaction to the vaccine that's significant enough for you to go see a doctor about is 1 in 10,000. Contrast this with data from the National Safety Council that says your lifetime risk of dying in a bicycle accident is 1 in 4,000. And your risk of dying choking on food is 1 in 2,000. Crazy, right? Whew. Bottom line, the vaccine's very safe. So in summary, nothing we ever do is completely safe. But getting this vaccine is way safer than most of the stuff that we choose to do in our day-to-day lives. It sounds like it's new to us, but there's actually over 15 years of research backing these vaccines already. The criteria to get a vaccine approved for use in people is very, very strict. And these rules were not relaxed in any way. They've gone through every testing phase and met every safety analysis required by governments around the world. And they were able to do this quickly for a number of reasons. Number one, people have been working on developing a vaccine for this since day one of the pandemic. Number two, buttloads of cash from virtually every country in the world, as well as all the top experts in infectious disease, vaccine manufacturing, and all that kind of stuff have been thrown at this in a worldwide effort, the likes of which have never been seen before. Number three, mRNA vaccines are super quick and easy to make. Not like older vaccines where you actually had to grow these diseases in the lab and then find ways to weaken and disarm them so they can be safely turned into a vaccine. Number four, COVID-19 is everywhere, which makes this virus way easier to study than a lot of other things that we have vaccines for. Number five, with unprecedented access to social media and people locked up inside their houses bored, volunteers to do studies and tests were easier to find than ever. Put it all together and boom! We've got the fastest developed vaccine in history without compromising safety or testing in any way. Pretty amazing when you think about it. And yes, there are variants and mutations of the COVID-19 virus that are starting to circulate. So far, the experts believe that these vaccines will be effective against these variants and expect that it should remain so into the future, but there are no hard guarantees on that.